Hello to everyone and welcome back to my channel. My name is Tommy. I'm a human nutrition student and researcher at the university. What I do in these type of videos is to synthesize the classes and then explain and teach you the best and most valuable information you need to know. Today we're going to continue the Physiopathology series of videos and we're going to take a look at nutrition-related diseases. So let's begin. Diabetes mellitus. Absolute or relative insulin deficiency. The types are primary, type 1 or type 2, and secondary. Counter-insulin hormones, for example the corticosteroid use, or the pancreatic insufficiency, for example alcoholic pancreatitis. In the primary we have the type 1, which is the destruction of the beta cells, absolute deficiency of the insulin, autoimmunity, genetic or idiopathic. If there is high glucagon and no insulin, there is a high risk of ketoacidosis in this type 1. Type 2 is insulin resistance, genetic, obesity, sedentary lifestyle are correlated. The fatty acids inhibit the GLUT4, which is the glucotransporter number 4, translocation in the muscle cells, for example. And this type 2 goes from an hyperinsulinemia in the early stages to a hypoinsulinemia. The causes of this are the sedentary lifestyle, the excessive carbohydrate intake, the glucotoxicity, the islet hyperactivity and subsequent exhaustion, and the activation of the renin-angiotensin-aldosterone system. Because of the angiotensin, it tends to put fat around the islets, impeding them to detect the glucose levels in the blood, and therefore adjusting it. The diagnosis of the diabetes: fasting blood glucose over 126, and 2 hours after any meal, the glucose over 200. Glucose overload test when we are uncertain. It is providing 75 grams of glucose, and after 2 hours we check the glycemia. If it is higher than 180, you are diabetic. In the clinic we see hyperglycemia, weight loss, no nutrient utilization because of no insulin. The classic triad is the polyphagia, we eat a lot, polyuria, we urinate a lot, and polydipsia, we drink a lot. There's also an increased hemoglobin A1C, and it is the diabetes mellitus control marker because it tells us about the average glycemia in the blood in the last 3 months. Diabetic microangiopathy also happens. This is the diabetic retinopathy, heart attacks, strokes, and polyneuropathy because of too much glucose in the blood. The treatment, non-pharmacological, is the lifestyle changes, mainly in the type 2. And pharmacological, using insulin in the type 1, metformin in the type 2, and incretins for the diabetic obesity. Diabetes symptoms: always tired, always hungry, frequent urination, blurry vision, sudden weight loss, and number of tingling hands and feet, wounds that don't heal, always thirsty, sexual problems, and vaginal infection. Now we talk about dyslipidemia, alteration of blood lipids that are related with the atherosclerotic plaque. Cholesterol is essential, and the triglycerides are used as an energy source when fasting. These are the two main ones. They are transported by lipoproteins in the blood, and the apoprotein is the one in charge of maintaining the structures so the lipoproteins don't get screwed over. This is the general mechanism. So we ingest the lipids, they get in the small intestine, they are absorbed, they are put in the chylomicrons. Chylomicrons travel through the blood, and there is the lipoprotein lipase that releases the free fatty acids to the tissues. Then the chylomicrons go to the liver. In the liver they release all the cholesterol and the free fatty acids. Then these two can be bound together again and create the very low density lipoproteins that travel through the blood, releasing free fatty acids using the lipoprotein lipase, creating IDLs and then LDLs. And then the LDLs release the cholesterol to the tissues, and once the cholesterol is used and there is an excess of it, we use the HDLs. So from the tissues we put inside of these HDLs the excess of cholesterol and we bring it back to the liver. The problems happen when there is hypercholesterolemia, hypertriglyceridemia, or both. They can be primary, so genetic, familial is the most common, or secondary, based on diet, lifestyle, or diseases. Hormonal causes, for example hypothyroidism, estrogens, anabolic steroids. Metabolic causes, diabetes, obesity, or lipid dystrophy. Also kidney diseases, liver diseases, lifestyle habits, and medication. So now let's take a look at the atherosclerotic cardiovascular disease. How it is supposed to work? High nitric oxide will create vasodilation, and this happens when there is inflammation. Platelets. Foam cells, macrophages, eat the oxidized cholesterol, and there is a creation of fatty streaks. Then the microcalcification plus a fibrin coating will create the atheromatous plaque. Diagnosis. When we have an HDL lower than 40 milligrams in men and lower than 50 in women, cholesterol higher than 190, LDLs higher than 115, and triglycerides higher than 150. Diet influence. Saturated fats as well as cholesterol, they may increase the risk. Monounsaturated, they lower the risk. The polyunsaturated, they lower the risk as well. And the trans fat increase the risk by a lot. Protein, they lower the risk if coming from vegetables. Carbohydrates, they increase the risk if there are sugars or if they have high glycemic index. Fiber lowers the risk, higher calories, higher risk, and alcohol as well increases the risk. Lipid lowering drugs are the statins mainly, the PCSK9 inhibitors, the fibrates, the cholesterol absorption inhibitors, the nicotinic acid, and its derivatives. Malnutrition now. So I've done a video talking about malnutrition in much more detail in this series, the clinical nutrition. But very summarized, we talked about marasm, kwashiorkor, and cachexia. The main difference between these two and cachexia is that cachexia has an increased metabolism because of the tumor, as well as a higher protein synthesis. The marasm is a weight loss, normal albumin, and preserved immunity. The kwashiorkor is a low weight loss with low albumin and impaired immunity. Sarcopenia and vitamin deficiency, lower hormones, lower proteins, and lower exercise will create the sarcopenia and the age as well. It's a muscle loss. And the vitamin deficiency, pellagra and scurvy mainly. So vitamin B3, niacin, and the vitamin C. Obesity, high blood pressure, 140/90, and increased cholesterol over 200, and diabetes, 126, 200 after meals. Now let's view the inflammatory bowel disease. Due to high processed food in modern countries, remember that high processed in modern countries causes genetic, immunologic alterations of the intestinal mucosa, and environmental alterations as well. The microbiota alterations, for example, when there is the Clostridium difficile. Diet alterations, vitamin D deficiency. Also, the non-steroidal anti-inflammatory drugs are associated with this, and they say that tobacco can have a little protection. But that's not recommended because I personally prefer to have one of these than to have lung cancer. So we have two mainly. The Crohn's disease and the ulcerative colitis. The Crohn's disease depends on what is affected. Higher inflammation, diarrhea, mucus, blood, lower weight, fever, anorexia, lower eating and restriction, they create malnutrition. The characteristics of this Crohn's disease is the inflammatory diarrhea, pain and general symptoms. Stenotic, so closing of the gastrointestinal tract, causing bloating and colicky pain, and the fistulae in the ileocecal, colonic, and also, but rarely, in the esophageal and gastric regions. On the other hand, the ulcerative colitis is depending on extent and location. 95% of the cases affect the rectum. They tend to start there and then go up the colon. Blood and mucus in stool, fever, vomiting, and urge to defecate all the time. Diet must be healthy with fiber and fruit because they could prevent the appearance. Ultra-processed food have a lot to do with the appearance, again. High variable calorie and protein requirements because these depend on, again, the extent and location on what is affected. There's no specific diet to this and no restrictive if not necessary. Higher risk of lactose intolerance and no insoluble fibers. Intolerances are reversible over time though. Whenever possible, prioritize oral nutrition, then enteral nutrition, then parenteral. Of course, if oral is not enough, we use the nutritional supplements. The diagnosis is in the clinic, in the laboratory, using a radiology, endoscopy, or biopsy. And now diabetes management. Diagnosis. We already talked about this. 126 fasting plasma glucose. 200 after the meal. Hemoglobin A1C over 6.5. And general diabetes symptoms plus a random plasma glucose. All parameters are equally important, of course. The type 2 is the most frequent, and in both cases we have insulin deficiency in the end. The treatment there is a difference in control between 2008 and 2015 guidelines, because we started to introduce individualization, which is very important. We also have to control all the parameters such as the fat, the weight, the blood pressure, the lifestyle, the consumption of tobacco and alcohol. Indeed, we have to recommend the lifestyle changes, so a better lifestyle, and control metabolic factors, as well as comorbidities, very, very important. Nutrition, exercise, tobacco, self-control, psychological sphere, and also social economic factors. These are the factors that determine the appearance of diabetes, especially the social economic ones, because if you don't have enough money, chances are you're not able to buy the healthier food. And the majority of the times, food that is cheap is not healthy. Primary prevention, lower the weight, increase the exercise and the fiber. But also, every move counts. So do physical exercise. Physical activity is very important. We have to fight the sedentary lifestyle that's progressing nowadays. And it also lowers the medication doses. So a win-win for everyone.
Well, not for the pharmaceutical industry though.
So now let's take a look in much more detail at lifestyle changes. The recommended diet is the Mediterranean diet because it can be very helpful for diabetes. They say that high fruit and veggies, olive oil, grains, legumes, fish and nuts are the base for a healthy diabetes diet. This is the Mediterranean pyramid. It consists of 40 to 55% of carbs, 10 to 20% of proteins and 30% of fats. We have to prioritize lower glycemic index foods, but they say that it's not enough because of mixing with other foods. If we eat, for example, a lot of fruits and veggies, but then we eat some bread, then that's higher in glycemic index. The alcohol and sodium consumption are same as normal, but then we have to, again, individualize. Pharmaceutical changes. In 2023 treatment, the medication with cardiovascular and renal benefit. So both, not only cardiovascular because of insulin, but also renal, because higher glucose in the blood will damage the kidneys. Metformin, which is the main drug used to treat diabetes type 2, has some side effects, for example, the lactic acidosis. We use also the basal bolus therapy of insulin. So we have a basal insulin to maintain throughout the whole day, and the bolus, when we eat, we give an extra boost of insulin. So as you can see here, there is a progression in the guidelines. In 2015, they were talking about mono, dual, triple and injectable therapy. In 2019, they gave more importance to morbidity of comorbidities. And in 2022, they gave importance to the effectiveness and price. And now in 2023, they give importance to a great diagnosis, lifestyle and drugs. This is the 2015 guideline. So as a conclusion, to treat diabetes, integrated, so regarding all the aspects of diabetes, not only the disease, but the lifestyle, the problems, the comorbidities attached to it, and individualized treatment. That's the main point. And now, last but not least, we talk about metabolopathies. These are primary alterations of the metabolism leading to disease. Dietary and nutritional treatment is possible. Inborn errors of the metabolism. So how can we get these diseases? By accumulation of toxic substances, by accumulation of non-toxic substances, because accumulation can put pressure on other anatomical structures, the energy deficit due to primary blockage of some pathway related to ATP synthesis, so basically no ATP creation, glycogenosis type 1, 2 and 5, the Macardel syndrome, and the effects of fatty acid oxidation. The end product deficit, so primary blockage of an anabolic pathway in the albinism, for example, or the absence of detoxification, a primary blockage of a catabolic pathway, for example in the urea cycle defects. So here a blockage in the anabolic and here in the catabolic. So here we have three main ones. The hemochromatosis, which is an iron accumulation. It is an impaired iron metabolism. There is a hyperabsorption at an intestinal level and the iron accumulates in the liver, creating a liver cirrhosis. The diagnosis is higher iron and transaminases as well. Treatment: frequent blood donation. hyperuricemia causing the gout due to increased uric acid or decreased excretion. In cancer patients, it's due to the cell death. Should be excreted in the urine but may form the stones. There are a type of kidney stones coming from uric acid. The treatment using anti-inflammatory drugs, the allopurinol, which tricks the xanthine oxidase and prevents the uric acid production, which is very interesting, this one, and also a diet low in purines and pyrimidines, a vegetarian diet, because we find uric acid coming from purines and pyrimidines in meat, for example. Lysosomal diseases, inherited lysosomal storage diseases. Types, we have the Gaucher, which is recessive, the Fabry, which is female to male by gender, and the Hurler, the variable penetrance, fast or slow progression. There is no dietary change that can help, unfortunately. Administration of enzymes from a bioreactor. This is the treatment. For example, the production of lactase, the enzyme that converts the lactose into glucose and galactose, comes from a bioreactor. Other diseases are regarding porphyrins, for example, an alteration of the heme metabolism, the group of the hemoglobin, causes the porphyric disease. Dracula was porphyric because he couldn't be exposed to sun, because he will get sunburns. Wilson's disease, disturbance of copper metabolism, an accumulation of it. Connective tissue diseases, the Ehlers-Danlos loss, which causes hyperelasticity. Osteogenesis imperfecta, which causes children with glass bones, and also the dwarfism. Amino acids, phenylketonuria, albinism, hyperoxaluria, homocystinuria, and cystinosis. Membrane transport, the Fanconi syndrome, and regarding glycogen, the Pompe disease. Okay, that's it for this video. I hope you understood everything I said. If you didn't, there is a comment section down below. Remember to download this diagram by clicking in the first link in the description. Don't forget to like, subscribe, and share this video to your friends and family so they can learn something new today. Thank you so much for watching, and I will see you in the next one. Ciao!